Glyceryl Trinitrate GTN for short, also known as nitroglycerin, is a vasodilator primarily used for anginal relief in patients presenting with chest pain and suspected acute myocardial infarction. The vasodilatory effects of GTN come from release of nitric oxide with venodilation at lower doses and arteriodilation at higher doses, resulting in preload and afterload reduction respectively. Nitric oxide mediates this process by activating the enzyme guanylyl cyclase, driving increase in the nucleotide cyclic guanosine monophosphate, which leads to dephosphorylation of myosin in smooth muscle. This promotes smooth muscle relaxation, resulting in reduction of preload and afterload. This effect is especially pronounced in the coronary vasculature, in turn increasing cardiac perfusion, making it ideal for the treatment of angina from an acute coronary syndrome and hypertensive emergencies like acute heart failure, pulmonary edema, and aortic dissection. GTN is rapidly absorbed via the skin, mucous membranes, and gastrointestinal tract, making it highly bioavailable with a half-life of 1 to 3 minutes. Thus, GTN can be easily administered orally, lingually, sublingually, or topically, as well as intravenously. GTN is primarily eliminated via metabolism in the liver. GTN is most commonly administered as a tablet that is absorbed sublingually. Patients may be prescribed GTN as prophylaxis for anginal chest pain before an event that may provoke anginal symptoms. They must be instructed to allow the nitroglycerin to dissolve in their mouth and allow their oral mucosa to absorb the drug. The dose is repeatable every 5 minutes until the achievement of relief. If anginal pain persists after 3 doses, prompt medical attention is required. After administration, the onset of vasodilatory effects occurs within 1 to 3 minutes, with a max effect occurring within 5 minutes. GTN infusion is used most commonly in emergency rooms and intensive care units. It is administered as a 5% dextrose and drip with non-absorbing PVC-free tubing, and it is indicated when sublingual GTN has failed to provide symptomatic relief, or if rapid and continued relief of symptoms is necessary. Intravenous GTN is frequently used to treat acute coronary syndromes, hypertensive emergency, and acute congestive heart failure exacerbations. When administered, its effect requires tight vitals monitoring. It should be kept in mind that continuous intravenous infusion of GTN can lead to the development of tolerance. Transdermal methods of GTN administration are also commonly administered in emergency rooms during acute angina attacks. It is typically for patients that cannot tolerate the sublingual administration of GTN, or have a previous adverse reaction to the sublingual tablet. Absorption takes about 5 to 10 minutes for full effect. The ideal application is on a surface with minimal hair, as hair can inhibit absorption, and care is necessary not to apply repeatedly to the same area if multiple doses are required. Repeated application of the ointment to the same area can cause skin irritation and dermatitis. The contraindications of GTN include hypersensitivity to GTN and patients on other vasodilatory nitrates. Other vasodilatory nitrates should not be given to patients who have taken a phosphodiesterase 5 inhibitor, like sildenafil or tadalafil, within 24 to 48 hours, due to risk of severe hypotension. Phosphodiesterase 5 inhibitors have proven to accentuate the hypotensive effects of nitrates as they selectively block phosphodiesterase 5, the enzyme necessary for the breakdown of cGMP. The additive effects of increased cGMP levels can result in excessive vasodilation and accentuates the hypotensive effects of nitrates and precipitates syncopal episodes. GTN is contraindicated in patients with a known history of increased intracranial pressure or suspected head injuries, as vasodilation and subsequent blood volume increase within the cranial cavity can increase or aggravate ICP and worsen clinical outcomes due to neurologic injury. The most common side effects of GTN include headaches, dizziness, weakness, palpitations, vertigo, nausea, vomiting, diaphoresis, and syncope. There have also been reports of GTN-induced azystole. GTN has been a long-standing mainstay for treating angina and ACS and is generally well tolerated with a low risk for major adverse events, even when used at exceptionally high doses, that is up to 121 mg transdermal or 56 mg intravenous stat dose. The most commonly used dose range is 5 micrograms per minute to 200 micrograms per minute. The nursing considerations of GTN are: patients on AGTN infusion require strict bed rest to decrease the myocardial workload. Use non-PVC 5% glucose bags and low-sorbing PVC tubing infusion line. The infusion must be administered via an electronic infusion pump. Identify blood pressure parameters on prescription or clinical notes prescribed by medical team. Identify titration intervals on prescription. GTN infusion is commenced at a rate of 3 to 5 ml per hour, or as per local policy, and titrated up by 3 ml every 5 minutes, or as until the patient is pain-free, or the patient's blood pressure is less than 90 mm, mercury systolic, or as per local policy. Once a blood pressure response is noted, the dose increase should be reduced, and the interval between increases is lengthened according to medical orders. Administer via a dedicated line. Do not co-administer with other drugs. Continuous cardiac monitoring is required during GTN infusion. A baseline 12-lead ECG is needed to be performed. Repeat the ECG and notify the doctor again in the following circumstances. If there is any increase in their chest discomfort, the patient's pain is unrelieved following several increases of the hourly rate as per prescription. If there is any other deterioration in the patient's condition during administration of the medication, for example, the patient becomes pale, gray, dizzy, diaphoretic, and/or vomiting. Hourly peripheral intravenous site checks required. Phlebitis scoring must be performed. Baseline observations are documented, especially blood pressure and pulse, and observations are monitored every 5 minutes while titration occurs. The infusion is weaned on medical instructions, usually by 3 ml increments every 5 to 15 minutes. Watch for a significant rise in blood pressure or return of symptoms during the weaning process. Ensure the fluid bag is changed every 24 hours. Remember that intravenous GTN infusion for more than 24 hours may result in nitrate tolerance.